let us begin the training. So again, thank you for joining us today on this provider training on the XYZ package. Before we get started, I'd like to provide you with a little bit of history behind why we are conducting this training. The XYZ package has been in place as a rate setting tool used by DDAP, PACTA, the SCAs, and even some of our MCOs for quite some time. One of the things that has come to light over time is that the package hasn't necessarily been consistently filled out by providers across our field. In addition, there have been numerous changes to the package, especially with our transition to the ASAM. So we decided that conducting a statewide training on how to properly fill out the package would be a good idea. We do understand that we have some out there who've been filling out these packages for many years and understand it like the back of their hand. And likewise, we have some out there who may be seeing this package for the first time. So that being said, it's our hope that providing this venue will allow us all to be on the same plane going forward. So I'm going to introduce to you today our speakers. Again, my name is Steve Ross. I'm a special assistant to the secretary. We have with us today from DDAP also Jennifer Newell, who is the Bureau Director for Quality Assurance and Administration. And we have Erica Noko, who is a supervisor in our program monitoring section. So thank you, Jen and Erica, for joining into presenting today's training. And I will kick it over to Jen to begin.
Thank you, Steve. Steve, I'm going to actually just ask you to advance the slides when I get to that point because I was having some trouble doing that and toggling between a different screen with the actual XYZ package. So thank you all for joining us. As Steve said, we're excited to be able to deliver this training to you. This is something new that we've done, and we really are doing it so that we can help familiarize you with the XYZ package and maybe get you cleared up on or provide clarification for some things that may have been questions in the past and get everybody moving together as one as we go through the rate setting process. So I'm going to just go over a couple of general changes that we've made to the XYZ package, and then I'm going to just walk you through a couple of the first pages of the tool, and then we'll switch back and forth between Steve and myself and Erica to go through the whole package. So one of the things that we did was we rearranged some of the content in the package to eliminate some areas that were in there 2, 3, or more times, probably just as a result of revisions over time. But we removed all of the duplication and tried to just make things flow in a little bit more sequential order and one that would make sense to you as you fill out the package and to the SCAs as they review the package. We aligned our language with the ASAM criteria. As you all are very aware, we're working toward full implementation of the ASAM, so it makes natural sense to include that language within the rate setting process and within the XYZ tool. And as such, we added the 3.7 level of care, which is medically monitored inpatient services. And as you know, that was not previously a part of the rate setting process. We added an allowance for depreciation within the rate setting process and for rate setting purposes. So that's something new. And then we took out the medication-assisted treatment for buprenorphine, vivitrol, and methadone for medications that are used for the treatment of opioid use disorder. We took that out of the rate calculation, and so the calculation is really for the actual level of care itself, and the medication would then be a separate rate, a separate cost. Can you go to the next slide, please, Steve? So hopefully you've all downloaded the XYZ package from PACTA's website, or you have received it from your single county authority. And we're going to, as we go through some of the slides, we'll try to reference which page of the package we're in so that you can try to follow along. And one of the very first things that you'll hear us mention, and that we'll probably reiterate, and you'll hear it from the SCAs, is that you should always be using the most current version of the XYZ package, which you can always find on PACTA's website under their rate setting area. And we're very thankful to PACTA that they house the rate setting information on their webpage along with all of the materials That makes for a nice place for all of the SCAs and providers to be able to go to get the information and reference the actual rates. So I'm going to first go through the timeline for the XYZ submission and review process. And if you're looking at your XYZ packet, that's actually page 2 of the packet. And this whole process, the XYZ process, really kicks off, so to speak, with the submission of the provider's audits to the SCAs, which are due around November 1st or by November 1st. So between November and the beginning of March, the SCAs are taking a look at those audits and going through those for informational purposes. And a couple of things are also happening at that time. DDAP is taking a look at the XYZ packet to make sure we have it current and talk to our group internally and externally to make sure that there's nothing that needs to be updated, and if so, we make those updates and try to get the package out to you by December to January, so that you have enough time to complete it and submit it by or before March 2nd. That's when the providers submit the packages to the home SCA. Just in case that's a new term for you, the home SCA is the SCA that serves the county in which your provider is located. So SCAs then review the packages, and they do that. We require that that be done with a few other SCAs. We have in the package that there should be 3 SCAs reviewing that packet. They're reviewing it, and by or before April 15th, they're responding to you with a rate for the services that you've included within that packet. Between April 15th and April 30th, the provider could submit appeals to the SCA if they're unhappy with the rate that was determined. And then any appeals that can't be resolved between the provider and the SCA can be submitted to DDAP for our review between April 30th and May 15th. And then ultimately, by or before June 1st, the SCA that is responsible for that provider posts the rates to the PACTA webpage. Next slide, please, Steve. We'll talk a little bit about the appeal process. In a perfect world, the appeal process doesn't need to be used. However, that's not often the case for whatever reason. And so that we do have this process in place, and at level 1, we're on page 3, by the way, in your packet, if you're following along. Level 1 is where a provider that's not happy with the rate that was designated by the SCA can appeal that rate to the home SCA, and then the home SCA, in conjunction with several SCAs from the area, they would get together and review the appeal and determine whether there needs to be a change to that rate. Again, if that can't be resolved at level 1, level 2 is pushing that appeal up to DDAP's level for review. And in that case, the provider submits the information to DDAP, and then we have an internal committee that reviews the appeal and makes a determination. Generally, the appeal committee at DDAP involves Steve as the special assistant to the secretary, myself as the bureau director for quality assurance and administration, typically involves Erica as the representative from program monitoring, and may involve other folks from the SCA or DDAP as we deem necessary in order to have the most comprehensive information to be able to make a determination on the appeal. Next slide, please. I noticed that there was somebody in the chat that said they can't hear any sound, and so Erica, could you just type into the chat for me that that person should try logging off and logging back in? So we'll just continue, and we're going to go through now what would be page 4 in your packet, and that's really a checklist of everything that you have to submit to the SCA when you submit your provider's XYZ packet. You want to make sure that you're going down through this checklist before you submit, and make sure you have every piece, because if you don't submit all the parts of the checklist, your package would be rejected or considered ineligible for review. So if you're a provider that has been submitting these packets of information for years now, and you kind of have this pack of information put together, and you think you just use the same packet every year, make sure that the information on this checklist is updated, and that everything on here is included, so that your package, you make sure that it's reviewed by the SCA. Next slide, please, Steve. So we are now on page 7 of the XYZ packet. And here's where we start to get into the program descriptions of each of your each of the programs that your provider offers for which you are requesting a rate. So you Part B, or Section B, goes through basically a brief description of the services that you offer, the populations that you serve. We ask you to include the demographics of the population that you served within the last 6 months. We ask you to talk about your staff composition. We want you to submit some information about your board, specifically to make sure that there's persons in recovery on your board. We ask you to talk about the composition of it. We ask you to talk about your experience in serving the Medicaid or medical assistance population. We want you to show evidence of your experience by including some information about the socioeconomic data, percentages of clients on Medicaid. We ask you to talk about percentages of clients by income level, and so on. We ask you to give the SCA the name of somebody that can be contacted for issues relating to contract compliance or program monitoring, audit issues. We ask you to name somebody that can be contacted for oversight of the provider or the facility on a day-to-day basis. So that's just some basic information or demographics about the program that you are requesting a rate for. Next slide, Steve. Section C starts out with a checklist on page 8, where you're going to indicate the rate, the service for which you're requesting a rate. And we have medically monitored intensive inpatient services for adults and for adolescents. We have clinically managed high intensity residential services, which is that 3.5 for adults. And for adolescents, we have 3.5, and the name for that level of care is clinically managed medium intensity residential. And then we have clinically managed low intensity residential for adults and adolescents, 3.1, and that is halfway house. And I believe I missed 3.7 withdrawal management, or 3.7 WM, which is medically monitored inpatient withdrawal management. So you first go through and you check the services that you're requesting a rate for, and then you want to go through the narrative items that are lettered A through Q under the service activity description, where we're asking you to talk about the target population that you serve, your admission criteria, specialty services that you offer, how you go through the psychosocial history process, the type of treatment activities that you offer. We ask you to talk about the schedule, the frequency with which you offer or you deliver those services. How often do these things occur per the course of treatment? How often do folks have an opportunity to meet with a psychiatrist, a social worker, a psychologist? And I'm going to now let Steve talk a little bit about the package as it relates to 3.5 and 3.7.
Thanks, Jen. So 3.7 is a new level of care for us under ASAM, right? We had the 3.7 WM, which is our detox. We have the 3.5, which is our traditional rehab. But now we have this 3.7, which is is kind of like an enhanced rehab to meet the medical complications and psychological complications of those individuals who are above a rehab but don't yet quite meet the level of 4.0 hospital-based service. So as we've incorporated 3.5 or 3.7 into our package, we've had some discussion with providers and in-house and with our SCAs on how to develop a rate for that. So if the 3.7 is being provided on a freestanding facility that only provides that level of care, you would complete a separate XYZ package just as you would for any other level of care. The only exception that is going to come into play here is where the 3.7 and the 3.5 are delivered on the same unit. So if we have a rehab where they're delivering 3.5 and 3.7 on the same unit, this is how we're going to take care of the rate. You would first fill out an XYZ package for your 3.5. Once you've done that, the instructions on page 16 of the XYZ package will tell you how to complete the rest of the package for the 3.7. What you would be doing is after you complete the 3.5 package, for the 3.7, you would complete a section B, program description specific information for that 3.7 level of care, and you would complete a personnel roster and your HDA 311 forms revenues and budgets to capture the revenues and expenditures for the 3.7 above and beyond what's already included on the 3.5 XYZ package. In addition, you'd be submitting a budget narrative to justify those additional expenses for the 3.7, and then you would move to your rate calculation page, and you would calculate a rate for that 3.7, which would result, because it's only the additional costs above the 3.5, it's going to result in an enhanced rate that would then by the SCA be added to the 3.5 to come up with what your 3.7 rate would be when 3.7 services are authorized and delivered. And so now I will turn it back over to Jen to talk about transportation.
Thank you. So as we keep going through those items A through Q in the program descriptions or service activities, wanted to just point out a couple of things to everybody. With narrative item H, which is transportation, which is actually on page 10 of the packet. If you're requesting the cost of transportation, or if you're building that into your per diem calculation, the expectation is that transportation is actually provided by your agency. We've heard lots of situations where an SCA or organization reaches out to the provider and requests transportation, and the provider indicates that they don't deliver transportation, or they're not able to do that. However, it was something that was requested and built into the rate. So we just really wanted to point out that if you're building that cost into your per diem rate, that you're actually able to and willing to deliver it as needed. For narrative item I, which is staffing, and that's on page 11, we just wanted to mention that the calculations for turnover for administrative, clinical, and then combined are actually 3 separate calculations. So you're going to do a calculation of total staff for administrative staff and the staff that have left or vacated the vacant positions during the year. You're going to do that calculation for administrative staff, then you're going to do it for clinical staff, and then you're going to do total staff all together. So sometimes there are questions on that, and we just wanted to point out that bit of clarification. And next slide, please. I believe at this point, Erica is going to walk you through some of the next pieces of the XYZ packet. So we'll turn the presentation over to you, Erica.
Thank you, Jen. The next pieces that we have to present to you today are the actual forms, the workbook forms that you'll be filling out, as well as the budget narrative and the rate calculation page. So can we move on to the next slide, please? So the first form that we have in the workbook is your 313 RS, your personnel roster. So I'll be referring it to just as the personnel roster. So you must submit the personnel roster that lists both administrative and client-oriented staff. Those staff salaries could possibly be spread across multiple facilities, and if they are, we're looking for how that is prorated. Prorated salaries should really be based on total annual salaries and not exceed 100%. So we would be looking at not having you submit a packet that would include 130% for someone's salaries. Personnel costs, such as the CEO, the executive directors, the administrative assistants, clerks, accountants, billing positions, those are all considered administrative in nature, as well as your marketing staff as well. Next slide, please. Vacant positions, if they've been vacant for more than 60 days, we would really be looking for you to give us a written justification and a hiring schedule for those particular positions. Again, we understand sometimes it is difficult to fill positions in a timely manner. So just write us a quick justification for that and attach a hiring schedule, please. The subtotals on the administrative and client-oriented salaries must equal to that is on the 311, the expense page. Another thing I'd like to point out, I'd like to quickly kind of go back and discuss a couple of other items that are on the roster of personnel. Just wanted to point out at the top of the roster of personnel, you will see that it is for the upcoming fiscal year. So for the purposes of this presentation, that upcoming fiscal year is fiscal year 2020 to 2022. I'm sorry, 2021 to 2022. And we're looking for all positions, again, that would be identified at the facility. We're looking for the total annual salary, the numbers of hours worked. And if you have a chance to take a look at the actual forms, you'll see that it is broken out into administrative and client-oriented. Next slide. The next page in your actual workbook is a page that's identified as your revenues page. So in your workbook, what we're looking for you to fill out in the revenue and income is going to be for 3 fiscal years. So those fiscal years are your audited year or prior year actual, which would be fiscal year 1920. We're looking at the projected year, which is the current fiscal year, which is fiscal year 2021, and then your budgeted year. The budgeted year for this purposes is fiscal year 21-22. Providers should show all revenue and income that is applicable to the city. And that revenue and income really should equal the total facility expenses as it's going to be showed on your expense form unless that facility experiences a budget deficit. So if when your packets are being reviewed, it's noted that your revenues are not necessarily matching up with your expenditures, I would expect to have a few questions that might come back to you if you haven't explained that in your packet. Next slide, please. The next item in your workbook will be your expense sheet. So it's the 311 RS expense sheet. And on your expense sheet, you'll see that there are very similar topics as we've discussed before. You're going to submit and fill out the expense sheet to include your personnel and your operating expenses. So your personnel and operating expenses are going to be broke out by administrative expenses, client-oriented expenses, and the expenses for each one of the fiscal years that we discussed in the previous slides. So that would be your prior year actual, your audited fiscal year 1920, the current year, fiscal year 2021, and the budgeted year, fiscal year 21-22. Those expenses for your prior year actual, fiscal year 1920, those expenses should be directly tied to the audit. As you heard Jen identify a list of items that should be submitted, and those items, one of the items in that is the actual audit. Next slide. So if you're continuing to look at your expense sheet, you'll see that the administrative and client-oriented salaries are listed on here, and they must equal the information that you have listed on your 311 personnel roster. So again, I mentioned that twice. Typically when we mention it twice, it's probably something pretty important to remember. So again, I'll state it again, that your administrative and your client-oriented salaries that are listed on your personnel roster should equal what is listed for administrative and client-oriented salaries on your expense sheet. All other operating costs should be categorized as either administrative, client-oriented, or split funded, or split between the two different programs. And what we'll be looking for any split costs, we would be looking for you to provide a justification for how those expenses were split, and that can be in the budget narrative. And that piece, the budget narrative in your packet, that would be on start on page 15. The expenses, the line items that are actually on the expense sheet, each of them, we have definitions in the packet for you, identified as a uniform chart of accounts, and those definitions can be found on page 19 to 24. So that gives you a quick reference to go back to if you're unclear as how to identify or classify your expenditures. Next slide.
Okay. I'll take over from here. Thank you, Erica. I want to circle back to the 3.7 for 1 minute because I wanted to provide a reminder to the providers that as we're moving forward with the ASAM transition and 3.7 is a new level of care, one of the things that needs to happen is that DDAP is going through a credentialing process to credential providers as a 3.7. So while this venue is talking about rate setting, and you would need to submit an XYZ package to obtain a 3.7 rate. In order for an SCA to contract with you for 3.7, two things would need to happen. Number one, that XYZ rate would need to be granted, but also number two, the provider would need to be credentialed by DDAP as a 3.7. So just want to put that in there as a reminder. The granting of a rate, an XYZ rate for 3.7 does not necessarily mean that an SCA can contract with you. That can't be done before DDAP credentials you as that 3.7, and that process is ongoing between now and the springtime. So back to our expenses. Line number 309 is medical drugs and supplies. So we're asking you to charge to this category the cost of medical supplies and drugs used in the treatment of clients, but we have excluded specifically medications used for MAT in the forms of buprenorphine, Vivitrol, and methadone, which will be paid for separate from the daily fee-for-service rate. The idea behind that is, as we look to collaborate with our MCO partners and compare apples to apples, we know that on the health choices side, those medications are paid for by the physical health plan, not the behavioral health plan, and we're looking to do that likewise in our package. So what will be happening is that the SCAs will be contracting with you separately, one for the fee-for-service rate for treatment, and then they'll be building into their contract separate costs to reimburse you for the cost of buprenorphine, Vivitrol, and methadone as those are implemented on the inpatient levels. Line 327, line 320, there are two line 320s, indirect costs and then indirect cost depreciation. In recent years, the rate setting committee has worked with our providers and determined that the current year depreciation should be allowed as an expense for rate setting purposes. Depreciation is when we buy capital fixed assets, we can't charge off the cost of those fixed assets because they're capitalized on your balance sheet. So, but to allow the provider to expense those items over time, we decided that we would allow for depreciation to be captured. Since depreciation isn't a direct expense, but rather an indirect expense, we built in an additional line to 320 called indirect cost depreciation. And this is where we're going to allow the provider to charge off some of those depreciation costs for that current year on the XYZ package. Any providers that are claiming depreciation of fixed assets must include as a backup with the submission of the package a copy of their depreciation schedules, which need to correlate to the amounts claimed on the form HDA 311. In addition, if you're spreading your depreciation among admin costs, admin and client oriented, you should be denoting on your depreciation schedule which ones are admin and which ones are client oriented so the SCAs can compare those and it all makes sense. Column K. Column K on the XYZ form is, or on the Excel form, is a column that's not been consistently filled out. And what we did this year is we created a formula to automatically calculate that for you. So column K is where your current year, your budgeted costs that your expenses that you're claiming exceed your current year projected costs by more than 10%, you would need to provide some type of justification as to why it's over 10%. We built a formula into the Excel spreadsheet to automatically calculate that. So that will take care of, the calculation will take care of itself for you. But where you should see any of those line items, specific line items that are over 10%, you should be providing justification to the SCA as to why. That can be done either through an attachment that you add on, or you can note that in your budget narrative page. Speaking of the budget narrative, included in the package is also a budget narrative that you can find on pages 17 and 18 of the package. The provider shall complete a description for each of the budget categories. And just a disclaimer, a statement noting how you arrived at that number. Where those expenses are prorated between administrative and client-oriented, you must explain the methodology for allocating those costs between the two. As an example, rent prorated between administrative and client-oriented based on square footage. And next is our rate calculation page. So now you've gone through the majority of the package, you've gone through the guts of it, you've completed, all your program descriptions, you've completed your revenue page, your personnel roster, your expense page. That is all done to come to this rate calculation page. And one of the things that we've seen in the past is that the rate calculation page is often confusing to folks and it's filled out sometimes incorrectly. So we're going to give you this kind of tutorial to walk you through it. The rate setting process allows for a 20% cap on administrative costs. And that's why we have these two pieces in here. We have the total allowable budget and the total budget. Okay. So first you start by taking and figuring out your total allowable budget. Okay. That will be determined by taking the first step of the rate calculation page and taking the client-oriented costs, which is column I on page 2 of the HDA 311, and dividing it by 0.8. That gives you your total allowable budget number. Next, you're going to go down and you're going to figure out your bed days. You'll calculate your bed days by taking the licensed bed days for the activity, multiplying it by 365, and then multiplying that by an 85% utilization rate. That gives you your calculated bed days. Number 3, you're going to take the lesser of the total budget, which is column J on page 2 of your HDA 311, or the total allowable budget that you created in step 1 above, and You take the lesser of those two, you divide it by the bed day calculation that they came up with, and that's going to give you the rate requested. Any of the rates should be rounded up or down by 50 cents or to the nearest dollar. And then finally, that rate calculation page needs to be certified by signatures of both the CEO and the Chief Finance Officer and dated. And that pretty much completes your XYZ package. Now, there have been providers out there who don't want to consider a rate increase and don't want to go through the XYZ process. That process is still in place. There is a no rate increase form. So if providers finding themselves in a position where they don't need to request an additional rate, they can simply fill out that no rate increase form and submit it with the accompanying documents referenced in the form to their home SCA. That form can be found on either the PACTA website or from your home SCA. And last but not least, questions. So we talked about this training is being recorded and it's going to be posted to the DDAP website for those who want to go back and reference it, or for those who weren't able to view it today, or for new staff members who come along the way. Questions regarding this specific training can be submitted to the resource account listed here on this page, and we will circulate a frequently asked questions document in the future to respond to those questions. As always, reach out to your local SC, your home SCA with specific questions as well, and they can help you as well. That pretty much ends the training for today. We would like to thank you all for attending. We appreciate the opportunity to be able to present to you, and thank you.